All right, so quick disclaimer also, besides the recording part, is we completely understand that there's some privilege associated with hunting for vaccines in the ways that we're going to be talking about today. You need to have access to some sort of technology. It can be difficult to do on a phone instead of a laptop, and there's some transportation and time constraints involved as well. So we just want to come out at the front and acknowledge the privileges involved there. These aren't going to be accessible to everyone, but we're providing you with the amount of information we're able to give at this point, and you can always feel free to reach out with any questions or concerns. And second, we understand that the timeline of this workshop itself is going on in quite an interesting context. There's been a lot of grief and pain in our community, and we understand that this is just one more event to add to the list. So we appreciate you taking the time to view this, attend, however you are interacting with this resource. And we just want to acknowledge all of that. So without any further ado, COVID-19 vaccines.
Yeah, so to get started, we're going to talk a bit about what the vaccines are and how they work. And before we talk about COVID vaccines, we can talk just generally about how a vaccine would work. And so every vaccine in the world aims to increase your immunity or just train your body to fight a certain disease. And the way it does that is where you get exposed to a part of the disease or a weakened disease, and that will cause a stimulation of your immune response, but it won't get you sick. And so this immune response basically means that your body will start making those little proteins called antibodies, which, if you want to think about it without all the jargon, little warriors that will fight the disease when the time comes in the future if it actually infects you. But the important thing is it doesn't get you sick. And the COVID vaccines do the same thing. All three of them do. We're going to talk about today, even though they do things in different ways, but they all just aim to increase your immunity. So the first two we're going to talk about are the Moderna and Pfizer BioNTech, just because they work very similarly. They have the same mechanism and they are very same effectiveness as well. So they both need 2 doses for the full immune response. So I need to be 3 weeks apart for Pfizer, 4 weeks for Moderna, and that's just how the results came for the studies. And everybody's talking about mRNA right now. So it's important to just talk about what is that and how it works in the context of the COVID vaccines. So you can think of the mRNA as literally a recipe, and a recipe for a certain protein. So these vaccines just send this very specific recipe to your cells to make this specific protein, which is on the outside of the COVID virus. It's called the spike protein. And this protein is enough to cause the immune response to start happening. But the cool thing is, since this is just part of the virus, not the whole virus, you won't get sick from COVID because of it. There's no way. And one more thing too, that's a really cool fun fact is because there's been a lot of conspiracy theories about mRNA and how it works and stuff like that. mRNA is broken down very quickly by cells. And so first of all, there's a low chance of the long-term side effects people were worried about, but also there's no way that it will change your genes. So that's not going to happen. Now, the third vaccine that's out is a Janssen or Johnson & Johnson vaccine. And works a bit differently from the Moderna and Pfizer, but still in a similar way. And it only needs 1 dose, which is definitely the major difference between the two. So just like the Moderna and Pfizer vaccines, it also uses a message to the cells to create a protein, which is the same as the Moderna and Pfizer vaccine is the spike or protein or like a small protein outside, which makes the immune response happen. The only difference is that it uses a mechanism to introduce that message or recipe into the cell, which is called adenovirus, and it's a harmless virus. It just gets the message there. And so it has been engineered to deliver the message without getting you sick. So yeah. One more thing that has been really talked about is efficacy, and there's been a lot of talk about different numbers, like my vaccine has this number of efficacy, but this vaccine has lower efficacy. Is this worse? Is this better? And it's a very big thing to talk about. But the biggest thing, if there's one takeaway from this whole slide, is you should get any vaccine you're offered because nearly all of them are nearly 100% effective in preventing both severe disease and death from COVID. What an efficacy rate is basically when the vaccines in their specific companies are being tested in the phase 3 tests. They're just checking out like how many people got the disease later on or not. And basically it's done in different trials from different companies at different locations and with different COVID surges. So it's really wrong to compare them because it's like comparing apples and oranges. One more thing is that all vaccines have a less than 100% efficacy rate, which just technically means that you will still have a chance of getting the virus, but that is the reality for all vaccines. The most important thing, though, when you're thinking about a vaccine is called effectiveness, which is the ability to prevent you from, if you do get sick, it will prevent you from going to a hospital or dying from the disease. So all three vaccines, even though they don't have a full like 100% efficacy rate, all of them have nearly 100% chance of stopping you from getting severely ill or getting hospitalized if you do get COVID, even after the vaccine. So it's still a very good thing, I think.
So getting vaccinated is not only important for your individual health, but it's also a really important step to protect the health of your broader community and that close to home. And so like George was saying, the vaccines are meant to prevent you getting infected with COVID-19, but they also reduce the severity should you be infected later on. So this is especially important for reducing the infection rate of the community around us so that we have a better shot at being able to manage the virus and continue to work towards vaccines that are long lasting and continue to test the vaccines, but also because they stop the hospitalization associated with severe symptoms of COVID-19. So this helps to prevent overwhelming the hospitals in your area. So that way, if you have some other medical concern that requires hospitalization, you are more likely to be able to get help, be seen, get what you need without having to kind of deal with the hospitals being at their capacity. And so it's really important for people, especially who have chronic or emergency medical concerns, to be able to have access to hospitals in ways that they might not have when COVID was much more prevalent and when the vaccines weren't an option. And so another point there is that herd immunity depends on the reduction of that transmission that the vaccines can provide for us. And so yes, they'll stop you from yes, they'll reduce your chances of getting infected. Yes, they'll reduce the severity of the symptoms, but it's not known for sure whether or not they prevent full transmission or carrying of the virus. So that's why it's especially important that once you do get vaccinated, you also continue to wear your mask when you're in public settings and when you are with people who are outside of your pod or that you don't know whether or not they've been vaccinated.
So some tips for how to get an actual appointment to find the vaccine is have your insurance card ready, because a lot of pharmacies or clinics will have you put in your insurance information. So it's easier just to have it ready before you get online to make your appointment or get on the phone. And then also be prepared to get the vaccine on short notice, because most appointments happen within a week. And you want to be flexible because you want to get the vaccine whenever you can. And then check your email often, because if you get on wait lists or sign up for the Minnesota Vaccine Connector, that's how they will contact you about that.
So a really good first step into starting the process of finding a vaccine is signing up for the Vaccine Connector. So this one is the Minnesota Vaccine Connector. It's linked in this slide, which will be posted somewhere after this. And if you are not in Minnesota, check to see if your state has something similar, because it's a really helpful and fairly low maintenance way to kind of start that process. So how the Vaccine Connector works is you'll provide some medical, demographic, career, and like living information to sort of determine your priority for the vaccine. So once you've sort of given your occupation, like are you in healthcare, do you work with kids, can you work from home, you'll give information about that. You'll give an address to, prove that you're in Minnesota and available to come to the community vaccination sites, and then provided a little bit of medical information about pre-existing conditions or risk factors for COVID, stuff like that. You'll be assigned to a group based on that like priority for the vaccination, and you're not ever going to like hear what group you're in, but that's how they go about the random selection process. So within those groups, people are randomly selected to make an appointment at the community sites to receive the vaccine. And so the frequently asked questions say that non-residents that have a job in Minnesota can sign up, but they are never going to ask for any proof of that job. And other sources have said that Minnesota doesn't have any residency requirements for the vaccine. So if you have an address in the state of Minnesota, sign up, because the worst thing that'll happen is you won't get an email with your random selection. So it's always worth a try. And so a few other things to keep in mind is, again, check your phone and email often. You'll be given the option to receive text or email notifications. If you don't have access to those forms of technology, you can give them a landline. They will call you to set up an appointment. And it will ask you about your insurance, but you can select prefer not to answer, and you don't have to give any insurance information because insurance is not required for the vaccine and they won't ask for it at the community sites. I have insurance, I selected prefer not to answer, and I was still selected for a vaccine. And again, signing up with the selector doesn't necessarily, the connector doesn't necessarily guarantee selection. So it's a really good idea to sign up and then continue looking in other ways to find a vaccine or to book an appointment, because you might be able to get that faster than through selection with the vaccine connector. And on the day of your appointment, they'll ask you to bring identification. It's a really good idea to have that just in case, but in my personal experience, all they asked for was the confirmation code for the appointment that you booked, which is like a little barcode you'll get once you sign up, your date of birth and your name. So you don't need any documents proving you're in Minnesota, prove it your line of work or anything like
that. So next we just wanted to touch on some vaccine aggregator websites. So what these websites do is they compile a bunch of different pharmacies and other vaccine locations into one website. So you're able to use these to really find all the vaccine appointments around you. So there is a CDC supported site, Vaccine Finder, and specifically it's vaccinefinder.org, not .com. And then there's also, if you're in Minnesota, there's one that's supported by the Minnesota Department of Health that you can find on their website. And so how these resources work, basically you just type in your zip code or your city and state, and you'll be able to find available vaccines near you. You should be able to see a big list of different pharmacies and other locations, and you should be able to see if they have appointments, if they have available appointments, and you can check this often to see what's changing and what places might have appointments when you look. And so then the next option that we have is mHealth Fairview, which is part of the health services of the University of Minnesota. And so mHealth Fairview is currently vaccinating individuals who are 50 years and older, people with certain conditions and disabilities, and people of certain races and ethnicities who have been disproportionately impacted by COVID-19. So if you fit in one of these groups, it's a really good idea to make an account through mHealth Fairview. So regardless of your healthcare provider, you can make an account with them. It's called a MyChart account. If you just Google MyChart account mHealth Fairview, you should be able to find it. And then once your account is made, you can search for appointments within MyChart and then make your appointment that way. Everyone who I know who has used this option was able to find an appointment within one of the first 2 or 3 times they checked. So this, again, if you fit in one of these groups, this could be a really good option for you. One kind of funky thing about MyChart is you'll have to answer some security questions or call to get an activation code just to make sure that you're actually you. And then next, Walgreens. This is where I personally found my vaccine, and it's a pretty easy resource to use. So you just go to their website, make your way to their pharmacy section and the COVID-19 vaccination section, and then you just type in your zip code. So if there are appointments available, you can go ahead and make an appointment. But if there aren't, you can go ahead and check back regularly. I've had a difference within 2 minutes, or maybe it takes 3 hours. You just have to kind of check often, which is true of many of these resources. One kind of funky thing about Walgreens is after you enter this first zip code and then you answer a few questions and put in your information, it brings you to a place where you can actually pick out your appointment, but that will only check your actual zip code. So when you first check, it checks within 25 miles, but then it checks only your zip code. So you can put in different cities around you. So if you're in St. Paul, try putting in Minneapolis, try putting in Bloomington, other places around you, just to make sure that you're able to find those available appointments if they are there. And then with this and some other pharmacies, it can be helpful to create an account so you don't have to waste time putting in your information every single time.
So CVS is where I found my vaccine, and it's a pretty similar process to Walgreens, with you put in your information and put in your zip code or city to find available appointments near you. But one trick that I found is extremely helpful is if you go to the CVS vaccine appointment website, they have a list of all the available states that the vaccine is held at CVS. So what you want to do is go to any state that says it has available appointments. This can be like Idaho or Tennessee. It doesn't matter, because eventually you'll end up putting in Minnesota. But the first thing you want to do is follow the prompts after you pick your state that has available appointments. So you're going to enter your information, and then where it says determine eligibility is when it allows you to pick the state that you actually want to make your appointment in, and then you'll press Minnesota. So then you'll go to confirm eligibility and fill in all the information. And then when it gets to the specific area in Minnesota that you want to get your vaccine in, it's really important that you type in Minneapolis, Minnesota, because that's what I found worked for me, rather than putting in a zip code or even St. Paul. And that's worked for a lot of people I know, is putting in Minneapolis. And then the key here for CVS is you want to wait until midnight to press search on that Minneapolis vaccine availability, because midnight is when CVS puts in new appointments for their pharmacies. So when it hits midnight, you're going to press enter, and that's when new appointments will show up. And even though you typed in Minneapolis, it'll show appointments for St. Paul and in the areas surrounding Minneapolis, St. Paul. So it's also really helpful to make an account before, if you don't want to put in all your information again.
And then we just have some other options if you are not having any luck with the other ones. So first we have St. Paul Corner Drug, which is right near McAllister. And you should be able to go on their website, and they have a Google form that you can fill out to just get on their list to be randomly selected by them to receive a vaccine. Two important things with this: it does not obligate you to get your vaccine from St. Paul Corner Drug, nor does it ensure that you will get your vaccine from St. Paul Corner Drug. So it's just kind of another way to put your name in the hat somewhere. And Lily just shared that she has a friend who got on this list and was just randomly selected. So this might be an especially important one to do soon. And then our other three options here, Hy-Vee, Walmart, and Sam's Club, are just some popular businesses around the Twin Cities area that might be options for vaccines. So same process kind of for all of them. For Hy-Vee and Sam's Club in particular, if you're in the McAllister Groveland, many of the locations are a few miles away from McAllister and might require a car. So before you make an appointment, just make sure that you are able to get to those locations. And then for Sam's Club, typically when you shop at Sam's Club, you need a membership, but for this you don't. So you'll be able to make a free account online, and then you'll be able to also get into Sam's Club without a membership. So there should be no problems there.
So social media has a lot of resources for finding vaccines, and these are like the vaccine hunter groups that are across the different platforms. So on Twitter, there are two specific accounts for Minnesota that I found that posts live updates for where new vaccines are available within Minnesota and the Twin Cities. So these are automated Twitter accounts that just if you keep notifications on and follow, you'll get notified when a new post comes up that has new appointments at the various pharmacies or stores within the area. And then on Instagram, there is an account called Community Care Clinics of Minnesota, which posts their vaccine supply almost every day. And if you follow this account and get notifications for when they post, you'll be able to see when they have new shipments available, and you don't need an appointment to go to the clinic, and you just go to the address of the clinic, and you might need to wait in line, but chances are you'll get the vaccine that way. And then some Facebook groups kind of do the same thing as the Twitter groups, where they post, you have to join either the Minneapolis Vaccine Hunters group, which even though it's called Minneapolis, it still has appointments available all across Minnesota, or the St. Paul vaccine group. which just has it for locally St. Paul. So what you want to do is join the Facebook group and just keep notifications on, because they will post in real time when new appointments are available at different pharmacies and locations around Minnesota and in St. Paul. And so just some tips for on your appointment day. It's important that if you need to get a ride because it's somewhere you can't easily access it, if you ask a close contact or someone in your pod to drive you, that is very important, because it still needs to be someone who is in your pod, because you haven't not gotten your vaccine yet, and you need to still be safe about that. And then also let your professors, work supervisors, or coaches know if you'll miss something because of an appointment. And I know my professors and coaches have been really understanding of missing something because of a vaccine appointment. And then some things you want to bring with you are a form of identification. And I'm assuming that every site where you possibly can get your vaccine will have the specific type of identification that they want you to bring. For me personally, CVS asked me to bring a driver's license or other form of ID, but they didn't end up asking for it when I arrived. And then you want to wear a short sleeve shirt just for easy access to the shoulder, so it's not cumbersome for you to lift up your sleeve or pull down your shirt a little bit. And then you still need to wear a mask, as Joanna said, and George will explain why in a few seconds. And then on your first vaccine appointment, you will get a vaccine card, which is really important to keep, because you're going to need this card if you get your second dose, so they can confirm that you got your first dose. And then you'll need that vaccine card if you want to go to certain events or flying in the future, if they require a vaccine card for access. And then after you receive a dose of vaccine, most likely be prepared to wait for 15 minutes on site, because they want to ensure that there are no adverse or allergic reactions to the vaccine. And it's just a safety precaution for yourself. So plan for that, and also plan for expected side effects. And it might be helpful to keep the rest of the day after you get your vaccines flexible, and the day after you get your vaccine, just in case you end up not feeling the best and can't do some of the things that you were hoping to do.
Yeah, and talk a bit more about the side effects. It's important to know the side effects happen, but also the side effects vary a lot from person to person. And so some people might just get a sore arm, some people might get a fever or chills or a headache, but a lot of people also have just no side effects at all. For people who do have side effects, the most common ones are on the arm where you got the shot, you will get some pain, some redness and swelling. And everywhere else, you might just feel tired, you get a headache, muscle pain, chills, fever, and nausea. Again, this varies a lot. So you might get one, none, or all of those. It's really varies a lot person to person. Some people report to take a 2-dose vaccine, so Moderna or Pfizer, they report stronger side effects in the second one. But again, this varies. They usually last just 2 days, and you can treat those by taking some ibuprofen or aspirin after the vaccine, because there have been some reports that if you take aspirin or ibuprofen before the vaccine, there might be a lower response. So it's best just to wait until after you get the vaccine. Some rest, fluids, and moving the sore arm is good. Just take care of yourself like you're sick. One fun fact is just because you got side effects doesn't mean you got COVID or you got sick. It just means the vaccine is working really hard and the immune response is working really well to create those little antibodies or little warriors to fight off COVID in the future. One more thing to talk about after you get the vaccine is why you should still wear a mask and you should still physically distance until it is safe enough to remove those precautions. And why that happens is because, first of all, protection is not immediate. And so full immune response takes a long time to come. And so it takes about 2 to 4 weeks after your Johnson & Johnson vaccine, if you get that, and 2 to 3 weeks after your Moderna or Pfizer vaccine, the second one or the first one. And also, we're not sure if the vaccines protect against the COVID variants, so it's best to just be safe until we know more about that and how that works. Again, also, it's like Joanna mentioned beforehand, the community spread of COVID is one of the big reasons why the vaccines are being done right now, and we're hoping that's what the vaccine will do eventually. But for now, we don't have any evidence that that is happening. So for now, staying COVID safe will ensure that you won't spread COVID further, even if you got the vaccine or not. So I think that concludes our presentation for today.